Hello viewers, moi khan aji adi 18th October 2024 de Nagaland Civil Secretariat te aigina ase aro aji ade Health and Family Welfare Department bra State TB Forum meeting conduct kuribole ase to IB itula meeting opor de ki discussion chule itula opor de sai lobo.
We know that country has pledged to eliminate TB by 2025, and that's declaring that goal we all have to work very hard, and I'm very happy everyone is here to discuss the strategies how we go about it. See, what I have understood after joining the department that we need to have two-pronged approach. First is the medical part, identify people. You need to have diagnose the issue, and then medical, and then your diet part. So if we just concentrate on these two most important things, I think we should be able to control this and achieve our goal. So we will start agenda wise, but we would like to have introduction now because I'm coming for the first time. So I would like to know each one of you. Start with myself. I'm Anup Kinji, 2008 batch IAS.
We will go through the objectives of our State TB Forum, and these are the objectives which we can achieve. TB-free India. India has committed to end TB by 2025, 5 years ahead of the global SDG target. And this, our Prime Minister of India has launched this TB-free India campaign at Delhi End TB Summit on 13 March 2018. And as per that, we have the national strategic plans which we are following. And the campaign calls for a social movement focused on the patient-centric and holistic care driven by integrated actions for TB-free India. Union Health Minister also has launched this TB Harega Desh Jitega campaign on 25th September 2019, and this we are continuing to reinforce the efforts to end TB by 2025. This is the organogram which we have for our state of Nagaland, and it is same across everywhere. At the ministry level, we have the Central TB Division, and we have the State TB Cell. And in the state TB cell, we have this state program officer, state TB officer. Then we have our assistant program officer. Then we have IC officer, MOSTC, state TB cell. Then accountant, pharmacy, storekeepers, secretarial assistant, DOs, our PPM coordinator, DRTB coordinator. And here, we have this CTST lab at NHK where we have our microbiologists, senior lab technicians, numbering to 4. And at the district, we have this district hospital, we have the district TB center. And at the district TB center, the administration part is carried on, as well as recording and reporting of all the activities under NTP. This is being followed. We have district TB officers in all the 11 districts, 16 districts we have, but we have 11 districts. The smaller districts, they are looked by the district TB officers. Then we have PMDT supervisors. Then we have senior TB supervisors, then senior TB lab supervisors. We have lab technicians. We have data entry operators, and PPM coordinator we have at Kohima and district. That is for our private sector. Then at the blocks we have tuberculosis unit. So it will be the medical officer of the treatment center. That means if it's at PHC, the MO who is there is involved, or at CHC. Then we have STS and STLS also at our tuberculosis unit. Then the microscopy centers, we have these microscopy centers, and these are designated microscopy centers. Of recently, we call it diagnostic and treatment centers. So the MO and the lab technicians are there, and we are using the mostly the molecular testing as of now for the diagnosis, and the microscopic part we are for follow-up and all. Then the microscopy centers, we have these microscopy centers, and these are designated microscopy centers. Of recently, we call it the diagnostic and treatment centers. So the MO and the lab technicians are there, and we are using the mostly the molecular testing as of now for the diagnosis, and the microscopic part we are for follow-up and all. Then we have dot centers. The dot providers are there. We have TB health visitors, like Zase is here this afternoon with us. So this is the organogram of how we are functioning for our reporting and recording and of the reports across the state. Then rationale for TB forum, we have is patient-centered and community TB-led response. These are the key success for the health program. And in this TB forum, we envisage to empower and engage TB-affected community, voice to the affected community for advocacy on resolution of challenges faced by our TB patients in assessing the TB services. So today we have our TB champions here, our cured patients who are the voice to the affected community for advocacy. Then TB forum will act as a bridge between the community, TB patients, the health system, then civil society organization, along with advocacy activities to influence policy changes for accessibility, affordability, and supportive TB services. So every district will have a TB forum, and comprises of 10 to 15 members. At the district level, we have our deputy commissioner, who is the chairman of the district TB forum. So in all the districts, we have this. Now, to continue with our objective for TB forum, one is to engage with policymakers and implementers to ensure justice, rights, and dignity of TB patients. So during the discussion, we'll talk more into this, and also to supplement and complement the government initiative to enforce TB patient-friendly law policies and programs, and to reduce stigma and discrimination for ensuring social security of our TB patients, the survivors, as well as the families, and to improve awareness on various governmental schemes, provisions, facilities available for TB patients, and improve the treatment literacy and adherence among TB patients. Another objective is to engage in evidence-based advocacy with the stakeholders. So the next slide, for terms of reference at the state and district level, the TB forum is there to advise on the strategies for engaging communities affected by TB and increasing the community participation in TB programs through network formation. This is ongoing. To periodically review progress of the involvement of the community network, highlighting the concerns and need of TB patients, to work with different stakeholders to develop better and more responsive health services.
Number 1, garnering political commitment from elected representative. Action points: participations of CMOs and district TB officer in the district planning board meetings to be initiated. And action taken: CMOs and DDOs in the districts are participating in district planning board meetings. And during the time, the DDOs as well as the CMOs, they are presenting, giving presentation on TB and Pradhan Mantri TB Bharat Abhiyan. Second one, community.
Was it not specifically like regarding the political commitment? Do we need to, apart from that, participation is fine, but apart from that, did we plan to, meet our legislature, and what was actually that point? What was the agenda?
Yeah, so in the last review meeting which we had on August 6th with our medical minister and our directorate, we have brought up these points also for discussion. so that we bring in more Nikshay Mitras, support of TB patient, donors for support of TB patients.
So this may be from second, even the CM has given a commitment to support certain numbers of this Nikshay Mitra.
Maybe yeah, definitely. Even the CMOs, they can visit all the their political representatives in their district. Apart from this, only in that meeting, they can always approach them. All the MLAs which are there in their district, and there must be ministers also. Minister.
Yeah.
So then you can do that also. No? You can contact them.
Yes. Through our district TB officers who are there.
Definitely.
Number 2, communities support the TB patient, that is Pradhan Mantri TB Mukht Bharat Abhiyan. Action points to identify potential donors such as corporate entities, NEPCO in Wukha, banks, corporate society, NGOs, individuals, including partner organizations who are willing to become Nikshay Mitra. And action taken, at present we have 347 individuals donors, 14 NGOs, 8 institutions, 2 elected representatives, that is from Wukha and PEG, 1 corporate from Mochong, and 21 others are Nikshay Mitras.
So this is addition to what it was earlier, or you are telling the same data it was in the last meeting?
Yes.
Has there been any addition in this? The
No,
numbers?
Nikshay Mitra we did not get, it has not increased yet.
Then 6 months में तो increase होना चाहिए ना. Then we are not actually should increase ना. Number should increase.
This is not as of today, sir. This is not as of today. As of today, it is slightly increased. The numbers are increased. I'll be presenting during the discussion. So this is little increased. It's not 347. Now it's around.
393.
So it's 392.
Then should be updated. Na?
Yeah.
But then yeah.
Yeah, as per the last meeting on 28th November, the action taken report which was collected, this is the.
ठीक है. Then how can we make it simpler? Like I am an individual private person. I want to contribute.
They will be responsible for all these donation and all. So the the NGO can be in charge of that, and then NGO can provide with the QR code.
What is the process now? You please explain it, sir. How it's been done now?
No, currently what is being doing is like the money is being transferred to the DTOs, the district tuberculosis officers.
In their account.
In their, it may be in their account also, and
Also?
maybe directly in cash also.
This year, 22 TB champions are trained this year during the month of January, and 56 TB champions are trained in Health and Wellness Center. And 5th,
Train means.
TB survivor. We are giving them training for 3 days there. After that, we can call them as TB champion.
Training means to cope up with that. Huh? Training for what?
Training for TB champion, like after giving training, they can give their support to NTB with the religious leaders for awareness generation, incorporate key NTB message during Sunday service. Action taken, awareness meeting with religious leaders have been conducted in almost all districts and its ongoing activities. 6, relocation of TrueNet machines to increase case finding activities in order to achieve the target. Official communication has been sent to the CMOs through Principal Director, and this time reminder sent to all the district TB officer on 24th September 2024. And 7, participation during Village Health Nutrition Day, screening of presumptive TB patients, awareness activities. And district and TB staff are participating in Village Health Nutrition Day regularly by screening and testing of presumptive TB patients and giving awareness on TB.
District TB Forum, an important agenda is we bring our TB survivors or the TB champions to give a short message.
So the next one is on the Nikshay Mitra thing. So currently registered are around 400, agreed upon is 360, and patient supported is around 900. So currently on treatment is around 2,700, which means that we need to support around 1,800 more patients. So the campaign that we are just after the governor's review, sir, the campaign we are talking about, no, sir, so that we can discuss more on that.
모두 목한 자리죠. 그만 시버랑 그모도 테스트 그리디요. 그모도 나빠래. 그모도 가보 어디 그모도 나빠래. 그모도 가요. 안지갈 있는 폴란드 나세. 패밀리 그모도 아차 군에 테스트 그게. 한 이도 인게스 टाइप पॉजिटिव जे तला खानदान खान तला ने प्लस आई तो खान फैमिली खान जो इन्हें टेस्ट कुरी दी सके कम में सब तो कुरे कुमा ना होले तो बिशी 100 to 99 ने कुरी दी कम टेस्ट
1% के भी कन्विंस शुरू करा ना
अब कुमा तो बोले तो ओए कुमा तो ना पड़े को तो बोले इनके लाइक अल्कोहल को भी देता है जो खाके जो करने ना पड़े सर इतनी है ना सर खान अच्छा है बिशी बार अच्छा है को
only on the way kilai do na
ओ
looking at kilai is it in front of you the detect the droplet to make sure ये दवाई तो नहीं चाहिए
टीबी का तो दवाई खा खाना तो सर खा
टीबी
आप तो खादु खाए बिशी बाबू
खादो खाइने
ओ
और प्रोफाइलेक्सिस तो किन्हें बोले तान
itu doctor khani sir khani di na ta khan mo khan na di ne sir khani di dia
field work ना वाले DTC दे वास्ते के अगर तो आई बोले लगी ना कोडे उठाई दी दाव
ra ta khan na ni ne ke no oi o ta khan oi kham mi sai do na itu baru moi sir khani de pola mi sir khani di sir khani ki mo khan di dia na oi thi sabara
itu sir khani ra be na ta khan di na TV do to ne khai na fa usi pula para ke suk thara musi to tahan usi help dise na ke ki le so dawa khan free para dise to man ne khala pa ki ne no free para dise ne ki le khala khan tahan sob sai na ke mo ta dise
कौन जगह दी खाशी
Naga hospital te.
वन महीना खाशी
6 months.
6 months
और लाइक अभी तो ऑडियो में डालो दवाई पैसे ना दोसर भी पैसे
So paise.
सो पैसे मिला ठीक पैसे
मतलब अंडा खान कि चांदा खान खान के paise.
दूसरा भी पैसे
इंडिया तो हेल्थ वाइज तो यू आर ओके ना
Yes.
इको दिखता है
아너 고래다는 숲대시 무시나 봐네 고래다는 게 기본 주나서 뒤뒤 분이다
Mohan family plan is
또 사람들 나이나
na mo taxi first.
디스팅구리 하서
वेरी गुड
DTC को हमारे ट्रीटमेंट करके रो इन्हें हम पीछे दे खुजमा हॉस्पिटल दे भी जाइए जाइने 1 month इन्हें बुहिशे और इन्हें दवाई खाना मोय MDR TB से और इतने खाना ट्रीटमेंट ना per month 500 इन्हें पता दी था ये है ना और nutrition it can be by na aro dawai can be free as a jiya na dawai khai thagi na bang hoi se dia lo aro spatan inya kan aro sai se check kuri se ni dia lo bang hoi se so yes
Scale up presumptive TB testing, no? So recently there are so many advances, so many strategies in the program, newer guidelines, and even her medicine, which was taken for 11 months, that is going to be shortened to 6 months now. So
the resistant one
yeah,
also.
resistant one also. So many advances are being happening. So, but for this, sir, you rightly said in the beginning that you said two main things: identification and then nutrition support and all. So one is how to identify more people and put them to test. So currently our status is like this. So we are testing around 1,500 people per lakh population. The national average is 1,700. So we are below the national average. So this really we need to really push our efforts here. So our notification against the target is 83%. If you see the diagnostic capacity, we have one handheld X-ray that's been given by the government, central government, and 11 CVNet machines, 11 TrueNet machines through the program, and additional 7 machines from the state government that has been purchased during the COVID times. But there are around, I think, another 20 machines that are being that is still there. More than 20 machines that are there with the central government, state government. But I think that is being used for other purposes. We are not sure. We have, like even in the previous meeting, we have given the communication to the districts and all to relocate those machines and all. So
for what purpose, like they are being used?
So they are other purpose for example, viral hepatitis also they use that. So even if they are using for viral hepatitis, even they can still use for TB also. Yeah, it's just the chip is different. So chip it can be used. So if that communication can be given again, a reminder can be given to the district from your end, I think that will be very helpful.
To be used for both the purposes.
It can be used for both the purposes. Submitted some proposals for procurement of handheld X-rays.
We have only one.
Yeah, we have only one now. And this digital handheld X-ray is, sir, it's very useful. It can be taken anywhere. It's mobile. Costing it comes to around, now it will come to around 30, I think. Around 30 per mission. And most of the other states, they have either 5, 6 like that. At least we can have.
Have we tried this in CSR?
Sir, we are trying. I think there was a proposal that came from HLL also. And ma'am is trying through the CM Innovative Scheme, one, and another is through the Tribal Welfare Department. Yeah.
We have a CSR meeting on Monday. We'll take this up.
Yes, proposals has been submitted already, sir.
The viewers avnyan bra hunyo paishe ki itu meeting de discussion kan thagyala opode moikan bra aji kalibi saigina jaishu gile tuberculosis gile TB gile moikan bra itebi stigma dangor ekta bukina ase. For example, moikan la satini khan noile neighbor kan TB bukina ase kumba inya kushili mon bra tai kan ge iman discriminate kurina mon bra tan ge society bi include nokra laga noile osore ailibi khin lagina mon bra react krala inya incident kan banra bishi dikhe saigina jaishugile India laga census de 2023 la census de saina jaishugile 25,37,235 TB cases register kurigina ase aro out of that manu muria labi bishi ase count to aji discussion wala opode meeting wala opode monra hunyo pado idu TB tuberculosis laga disease to eradicate kuruli India ba pura puri ki karne koile world de saina jeshili India to top list ase idu TB tuberculosis la bimar de to itia mon ba itia meeting de dikhala isapte they are going to hold various programs awareness program kan launch kurubole ase tai kan ba aro house colony wise hobi tai kan bra district wise hobi village wise hobi tai kan bra inya awareness program kan dina birayam de department bra public kan gibi janai dia ase ki TB ge moi kan bra itia do discriminate nokri gina itu disease to curable disease ase koi gina than ge janai di gina itu awareness program kan launch krina jayam de participate kuli janai dishi aro itukla nohoi holibi TB bimar laga medicine kan do government hospitals kan de free of cost ase aro kitiaba mon bra incidents kan bi dikhe ki patients kan bra private hospital kan ra jaina than ba itula bimar laga medicines kan lobol bi jai holibi janai dia se ki arobi ki itu medicines kan do kuma do expensive bi thage kyarne kuli itu ek parkla khagina bimar bal holela noi holibi starting from a duration of 6 to 11 months in yan la debi curable hwa la bi ase tu idwarne public ki bi janai dia se ki TB la bimar hoise gule abunyan government hospital kan de jagina register kurigina free of cost itu dawai khan lobo aro dawai khan ekla free no hoy holibi nutritional essentials kan bi provide kore aro itu ekla no hoy holibi tai kan bra incentive puisa financial incentive kan bi provide kore kuna janai dia se to itu nishna ahadin khan de TB laga against TB awareness program kan hold krem de public ki bi janai dia se aro ekbar ki program kan hold krem de abnyan la village level hobi district level hobi aro colony level hobi jagina participate koribi aro itu awareness to janigina mo anbrabi itia do TB do curable disease ase kwala itu stigma aro discrimination na thagiole la society de itu aro bi public kan ge janai dia se. For more news and updates, this is Nufo Ayer with video journalist Ari Jinger.
Looking to elevate your team's skills in hospitality and customer service? At Emporium Training Institute, powered by Eagle Crest Training Academy, we offer customized workshops tailored to your organization's needs. From hospitality basics to advanced customer service, we deliver practical, impactful skills. Let us help you build a skilled, confident team. Emporium Nagaland, shaping professionals one workshop at a time.